Hi, my name is Adam Kegley, and I'm the manager of Global Partnerships at the Global Healthy Living Foundation. I'd like to thank you for tuning into the Strong Bones and Me Patient Story Series. The Strong Bones and Me Patient Story Series aims to raise awareness on osteoporosis, fracture prevention, and post-fracture care by sharing real-life stories from people affected by osteoporosis and the providers who treat them. They will share their experience living with the condition, its effects, methods of prevention and care in order to help inform and educate others so that living with osteoporosis can still mean living fully, actively, and well. Today, we're joined by Shelly from Massachusetts in the United States. She joins us to speak with us about her journey with osteoporosis and why she advocates to help people like her maintain their bone health to prevent future potential fractures. Hi, Shelly. Thanks so much for joining us today.
I'm glad to be here, Adam. Thanks for having me.
Very welcome. How are you feeling? Are you ready to jump right in?
Oh, I'm excited to be talking about this subject.
So, Shelly, if you want, you can go ahead and tell us a bit about yourself, including maybe what condition you live with.
Sure. Well, my name is Shelly, and I live in Andover, Massachusetts. I'm 66 years old right now, and I'm living with the condition of osteoporosis.
Thank you so much, Shelly. It's really good to speak with you. And, thanks again for sitting down to talk with us today about your story with osteoporosis. Actually, speaking of, how and when did you first learn about osteoporosis and your diagnosis? Maybe those two things occurred at separate times, or maybe they occurred at the same time.
Well, actually, I knew about osteoporosis because my mother had always had it. And I knew that she had gone on a medication, followed a course of prescribed medicines, and that had helped her. But I went through menopause at age 47, which is rather early. And then when I was 53, that was 2009, I was diagnosed with osteopenia. And so in 6 years, I had osteopenia from when I went through menopause. And then by 4 more years later, in 2013, I was diagnosed with osteoporosis. So it was soon after, 10 years later, I went from menopause to osteoporosis. It's a condition, and I didn't look at it as a disease. And I still don't, in a sense, in that I feel that it is a condition and you have to learn how to live with it successfully, and I've learned better ways of coping with it. Definitely.
I'm glad you talk about ways that, you've been able to live with the condition and that you don't necessarily consider it a disease, that you consider it something that you can live with and that you can still be yourself and live an active life. And I was wondering if you remember back to your first fracture, before it happened. What did you know about those risks there? Did you actually know beforehand about the importance of DEXA scans? Did you actually know about those before you actually experienced a fracture?
I did. And, I did know about them, and I do know about the risks. But I happen to be, an avid skier. And one of the reasons I wanted to steward my health and be a better steward, I should say, of my health in terms of my bone health, is that I wanted to continue to ski long into my, hopefully elderly life. I don't want to, I don't want to deny myself being able to have an active lifestyle. And those are things that matter to me. And so I wanted to be able to boost my bone health at this, and still maintain the same lifestyle I've enjoyed. So that has been a priority for me.
And that's really wonderful. I think it's absolutely incredible that you have such an active lifestyle. Like you said, you're an avid skier, you love to hike as well. especially while living with osteoporosis, you've been able to find a way to do those things while still living with the condition and not letting that stop you. I'd wonder, has, treatment helped you maintain that sort of confidence to do those kinds of activities without as much fear of fracturing?
Oh, that's such a good question, Adam, because the truth is, I wasn't comfortable and I was very uptight about it. And I had an extremely busy job. And about 4 years ago, I knew I was going to retire within 2 years. So I contacted the Bone Health and Osteoporosis Foundation and I asked them if I could join a support group because what I wanted was to learn more. So I had gone on an anti-resorptive medication and uh, it didn't agree with me. And that was when I was diagnosed with osteoporosis. And I tried it, and then I decided to do nothing. Well, in the meantime, I had decided to start this support group in 2 years. So I live in Boston. I called the group Osteo Boston, and we started 2 years ago. And we really basically ask researchers to come on and speak for an hour to us. Researchers in all different fields from diet, nutrition, supplementation, exercise, um, and current research and become more educated. And I think that's given me a sense of confidence and understanding more and knowing more. And then we post the videos onto YouTube, not the entire session, but the session um, with the specialist or clinician. That hour is put up on YouTube under Osteo Boston so that other people might want, get more education too. And there's certainly lots of resources besides that. But um, I was finding that I needed more information and it's been very helpful for me, and I think many other people as well. But it's, I think education's important.
I couldn't agree more, actually. And that's one of the reasons why we've put together the Strong Bones and Me initiative, to provide education and that awareness. And that's why these kinds of stories of, people and the willingness of those people to share these stories is so vitally important. And I think you brought up a really good point is that sometimes, certain treatments don't agree with certain people. And I wondered if you ever partook in any sort of service when you were diagnosed, like a fracture liaison service that kind of coordinates a comprehensive, personalized plan to help people prevent future fractures. Those things typically involve multiple care team members, blood work and DEXA scans that are routine, and also treatment. Did you ever participate in anything like that, or was that ever presented to you?
A good question. Not exactly in the format that you're describing, Adam, but actually, I feel like I was lucky in that my PCP recommended early on in my life to have a DEXA scan. Many women don't have that opportunity. And I believe I had my first DEXA at 53 and I did have osteopenia. My PCP was aware of my background, my family background, and thought it was a good idea. And I'm a small boned, petite woman. That's also part of the profile, but you don't have to be. It doesn't necessarily, um, you don't escape it necessarily that way either. There's many men and many larger boned women. But certainly that's one of them. And I felt lucky that way. I do feel there's a lack, since you brought this up, of a comprehensive format in dealing with um, this condition. When a diagnosis happens, I think we all want to understand it in a more detailed way, and I don't feel that I definitely got that. However, the care that I received was excellent in Boston. I did have blood work done, and I did have DEXA scan done right away. And I do have good follow-up from um, I was suggested to go to an endocrinologist right away or a rheumatologist, which are very important doctors besides a PCP to go to, your own PCP. So, those are things that I think are very important for women. And not every area has that kind of comprehensive activity going on yet. It's a great goal, though.
I couldn't agree more. I think the goal would be to always have some sort of coordinated approach after somebody fractures, right? To make sure that to help them so that they don't fracture again to prevent that. Did you I know you mentioned you went off treatment. Did you end up having to try several different treatments and found one that helps you the most? Um
Good question. Well, the truth is, um, I sought out a treatment on my own um, by you know connecting with an integrative health practitioner um, who suggested I go on hormone replacement therapy, which is now called bioidentical um, hormones. And I did follow a course of treatment with that, and I still am doing that. I've been on it for about 2 years now. Um, and I have seen a change in my bone density uh, results. Not a significant. It's more that it's mostly kept it at bay. Uh, kept me from receding and getting any worse. But um, and it's helped a little. Um, and so I think that's been what I have done so far. It doesn't mean that I personally, I would not try another medication from my doctor. I do like to follow the science, and I'm often very wary of not doing that. And I do think it's very important to be aware of where you're at all the time with this condition and what your numbers are and how you're handling it in many areas, your diet and all of those things, fitness.
That's actually the perfect point because that's what I wanted to ask next. Actually, is your did your doctor or care team kind of work with you to inform you about those lifestyle changes that you could make or that you could enhance that you're already doing? Things like your diet, things like exercise, vitamin D, calcium, things of that sort.
They were excellent at recommending calcium and vitamin D as supplements to take. But the truth is that I think I've educated myself the most through some of the resources the people that we've had on, the researchers we've sought out, and some of the fitness people. There's definitely things I do and don't do because of what I've learned, and I think that's been very valuable.
That's a really good point too. I think you brought up something really powerful there is that I find that in previous conversations and also what we've seen is that a lot of times patients end up finding the most information out for themselves, and they end up discovering sort of their what fits them and what suits them best on their own. And I wonder, um, what is the best advice that you've kind of found on your own? And then I would also ask, what might be the best advice that you found from your care team so far or your doctor?
Okay, well, I guess from some of my own research, some of the things that I would say is, be careful um, what you do in terms of you have bone quality and bone density. Both of them matter. And, there's things that, like that you don't want to do, like a sit up. Um, sit-ups can be very damaging. You can get fractures, rib fractures from doing them. And there's so many other core exercises that are better that will achieve the same thing and more safely. If you are going to do an exercise class, do it with someone who really understands osteoporosis. Many people don't. And there's weight-bearing exercise matters, such as, for example, running is good or walking is good. But I would say to people, probably, we love the internet and we like social media, but, be aware of when you're getting your resources from, it's nice to get support sometimes from some of these groups that are on some of the social media channels, but, there's fellowship, but you have to be careful because it's not real quality necessarily information. You have to follow the best sources. And so that would be something I would say is really an important piece. Maybe not to know that, like, if your calcium has 2,000 milligrams of calcium in one tablet, that you're really only going to absorb 500 milligrams at a time, and it's better dispersed during the day. I could go on and on. I probably too much, but yeah, there's a lot of things I've absorbed over the time that I think are really important. But if I were going to say what the most important thing was that I wish I could have go back, turn the clock back, to be aware that your hormones play a large role in your bone health.
That's a really good point. And I suppose, to all of those great points that you just said, I'd want to know what you might say to others who might be at risk of developing osteoporosis related fractures, or who live with osteoporosis and are afraid they'll fracture again. What might you say to them to help them move forward in their journey living with the condition?
Number one thing I would say is educate yourself, because the more you know, the more you can speak freely with your doctors about your course of treatment. So that's one thing. And I think don't be too afraid, because fear is not a good, driving factor in your health. And so many people live with this condition. It's a condition, and many people live successfully with it. Be aware of some of the things that you can change, and try to do one thing that will make you feel good about it all the time. And possibly to join a support group, and because I think it does help you, and to listen to programs like this one, where you hear other people's voices that have the same issues, and take some knowledge and comfort really in knowing that you're not alone in this, and that you can do things to help counteract it to some degree.
Thank you so much, Shelly. I really do think that, from hearing your story, I think people are really going to benefit from this, and from hearing how you don't let osteoporosis kind of drive you or keep you from doing the things that you love and experiencing life. And importantly, you can do all of those things because you help ensure that you can do them safely and smartly, with the help of, good lifestyle choices and treatment pathways that really help you live life the way you want to live it.
Well, great. I'm glad you got that from what I've said, because I do feel that way. Thank you.
Thank you again for tuning in to GHLF's Strong Bones and Me Patient Story Series. There is a lot of power in knowledge sharing, especially from different cultures and walks of life. And we hope that these stories help all of us remember that strong bones mean a strong me.